Dr. Rava Zolnikov is an associate professor at National University, focusing on aspects of culture in global health. She teaches courses in both the BPH and MPH program. Her primary courses are environmental health and global health. Dr. Zolnikov earned a Ph.D. in Developmental Science from North Dakota State University and an MS in Environmental Health from Harvard School of Public Health, and a second MS in Industrial Hygiene from Montana Tech of the University of Montana. She also earned a BS degree in Biological Sciences from Montana Tech of the University of Montana. Dr. Zolnikov works internationally on issues in low and middle-income countries, including Kenya, Ghana, India, Colombia, and Brazil. She has worked on a variety of public health projects ranging from infectious diseases such as Ebola and HIV/AIDS to access to water projects. She is primarily a qualitative researcher and concentrates on providing vulnerable populations with a voice. Additionally, Dr. Zolnikov is the vice president of a nonprofit organization, the Shepherd's Village, which focuses on providing access to water to Maasai communities in Kenya. Dr. Zolnikov has published extensively in some of the world's most renowned public health and global health journals, including the American Journal of Public Health, AIDS and Behavior, Science of the Total Environment, and many more. She has also written and published 2 books, which focus on qualitative research and environmental health.
Hello, my name is Dr. Rava Zolnikov, and I am an associate professor at National University. I have been with National University as full-time faculty for the last 6 years, but I actually was an adjunct before, so I have been at National University for a total of 10 years as a professor. I currently teach global health and environmental health, as well as capstone in the undergraduate and graduate programs. My research spans a broad range of fields, including environmental health, psychology, and global health. It's interesting because I don't necessarily focus on a specific area of research, and instead I focus on applying a specific type of methodology, which is qualitative. My research methodology can be put into any single field. So if you have a question on HIV/AIDS, I can employ my type of methodology within that public health problem. Qualitative research is interesting because I use interview and personal experiences to create a story. It's more of giving people a voice and less of putting a number on their head. So I like having that sort of personal approach to research. I am currently working on a lot of different projects, but that falls sort of in the range of psychology and mental health, and that I wanted and have wanted to understand how COVID has been affecting people in various professions and occupations. I'm also working on projects with waste pickers, who are people in poor income countries that sort through garbage to find valuable material to exchange for money. I have a whole range of projects. In fact, even this year alone, I've published 5 papers, and one was on climate change, one was on the adverse effects of perfectionism, waste pickers, and so my research really is quite vast, but all of it is qualitative in nature. A lot of my research interests derive from my personal perspective and views on life, in that I feel that people around the world should be given an opportunity, and that is reflective in the type of work I do. I work mostly with low socioeconomic populations. I also work with diverse populations who don't have full access to resources, including simple, normal things that, like education and water. I was raised in a poor family, and I remember how, despite the socioeconomic conditions, my parents really believed that education was the tool and the answer to creating change. And they were right. And they always said, we don't care what you study, but study it to the fullest of your ability. And so I think I took that a little too personally. And I was like, wow, yes, I do want to have this education, but I also want other people to have it too. So a lot of my research focuses on providing equality through, whether it's through mental health services, whether it's through education, water, improved sanitation, access to treatment. I don't care, but everybody sort of deserves that chance to thrive despite their conditions. So that's what most of my research focuses on. I came to National University and I started here about 10 years ago as an adjunct faculty. I remember feeling very strongly drawn towards the university because of that diversity, more minority and gender profile of the institution. And I liked knowing that I would be basically contributing to something that I believed in, which was giving education to people who maybe historically never had education, to first-generation college students, to students who went through the military to get a scholarship to pay for school. I also paid for my own school, all 11 years of it, and I know the struggle that incurs because of that financial burden. And so I love being at National because it provides that platform, that education for a lot of people who haven't really had that ability within their family. I am from a very small town in Montana with a population of 2,000 people. The nearest McDonald's is 65 miles away. So, and it's also very cold, and there was not a lot to do except study and play sports. So that's basically what I did. I played sports year round. It was volleyball, track, basketball, swim team. And that was my thing, and that was kind of everybody's thing. As interesting and maybe difficult as it was kind of growing up as a poor kid, I really had a lot of great experiences around that, and it was something that I was able to and am and now able to carry into my life now. I have perspective, and I think that that's something that, money can't really buy. I know what it's like to live in a mobile trailer with 6 family members and in negative 40-degree weather. I don't think a lot of people can say that. They have survived that. And I think that influences and has influenced my desire to help people in similar situations and circumstances. Because I had to pay for my own school, I knew that the only way I was going to be able to pay for my own school was through sports. And so I actually played college volleyball, and I earned full scholarship through volleyball and academics. And that's how I paid for my first college. I got my undergraduate degree. I actually quit playing. I got my undergraduate in 3 years. And then I took a break. I went back and I got my master's degree from the same school, which was Montana Tech. It was an engineering school, also kind of in the middle of nowhere. After that, I did work as an environmental risk scientist for a corporate bank, and I realized that I did not want to work in the corporate environment, and that I felt the change was very slow, and I just couldn't find my way there. So I applied to go back to school. I got into Harvard, and I studied there for 3 years, and then I eventually got my second master's degree in environmental health. And then I had started my Ph.D. there, but then I decided to switch into a different program because I wanted to focus more on culture. And what I kind of saw was a real disconnect between the linear approach that most academicians take, in that they see a problem, they want to provide the solution. And what I kind of saw while I was studying is that it's not that cut and dry. It's more of there's a problem, and then there's the people that it's occurring with, and those people experience different things and have their own thoughts and feelings. And so I got my Ph.D. in Developmental Science, which is kind of a psychology-related field. And I studied more specifically cultures. And so then I was able to apply like these very different fields together, which was global health, environmental health, and psychology, and kind of look at the application of interventions and maybe barriers to success through the lens of that population. Attending Harvard was definitely the hardest thing I've ever done in my life. I was completely the last student. I was failing all my classes. I felt like I was drowning amidst a sea of very smart people. And it was a very humbling experience, and yet somehow I knew I didn't want to quit. I remember asking for help. I would go into all the professors, all the TA sessions. I had many tutors, and I just never gave up. And I think that they saw that that sort of will to succeed, and they took me under their wing. Eventually scheduled an appointment with a neuropsychiatrist, and she diagnosed me with a severe learning disability, which I found out at the age of 29, and I had already been in school for like 8 years. And so it was also, again, very humbling to know that it wasn't in fact really dumb. I just was learning differently. And once I found that out, my teachers and my professors, it's like everything changed. People started helping me. They started accommodating me. I also have a diagnosed disability. So like many of my students, I love that when they ask me, I feel like it's sort of is scary for them, but I'm welcome them with my arms wide open. And I can only say that I love them just as much as I love my other ones. In fact, sometimes a little bit more, because I know the struggle that they have gone through. I remember when I was 18 years old, I modeled for a very long time. And this was a modeling experience I had, and I went to Honduras. And I was doing a jeans photo shoot with Miss Honduras at the time. And it was on one of the private islands. Honduras has these beautiful islands. And I met this little girl, and I remember thinking how stunning she was. And so I asked her mom for a picture with her. She had these like emerald eyes, and she was a little bit dirty. It was, if you've ever seen that picture of the most beautiful girl in the world, and she's from Afghanistan, the girl sort of looked like that. It was very stunning. And so I asked her mom if I could take a picture with her. And afterwards, I gave her $5 just as like a thank you. And the little girl gave it to her mom, and her mom just started crying. And that moment really changed me, because the 2 days just prior, I remember paying like $5 for parking. And I just had like a real shift of perspective, because, and at a little bit of an older age, not just growing up within it, that really changed me into thinking how things were kind of not fair in the world, and that I really wanted to create a change for people that maybe didn't have opportunities that other people did. That definitely started me down the path of global health and wanting to help. I always knew that I wanted to sort of be a helper, but I didn't know in what context and how to get there. And so that was a very defining experience for me. Today, I actually run 2 nonprofits. One of them is with my best friend and my brother from Kenya. And what we do is we get kids in school water. And the reason we get kids in school water is because If you've been to the bush out in Africa, they use that time while they're supposed to be in school to gather water. That means they're minus 2 hours of education. And so we saw this as a real big problem because the children were not only probably not getting as good of an education, but we're spending 2 hours of it gathering water. So what we do now is we pipe water from existing wells to schools. And we have gotten 8 schools water, and we probably serve over 10,000 people now. And these projects are ongoing, and they're all over Kenya, and it's a very exciting nonprofit to be involved with. And I go back to Kenya all the time, check up on my nonprofit or conduct research or see my family, which in Kenya, they really take you in as your family. The other nonprofit that I help run is a pilot project in Florida. And what we do is we provide complementary contraception. And this is more of on the lines of gender rights and providing, more of equality within gender. And so this one is also exciting because it's a pilot with Planned Parenthood of Florida as well. And so we are trying to create more of like a single entity within, instead of a big Planned Parenthood that focuses on reproductive rights. It's funny because one of my interview questions is, tell us about a time when things didn't go the way you wanted, like a promotion you wanted and didn't get, or a project that didn't turn out how you had hoped. But honestly, in academia, especially with all the stuff I apply to, I get rejected like 5 times a week. So my life is about like rejection. I get rejected so often that when I don't get rejected, I feel like, oh, wow, what's going on here? It's like a weird feeling to actually have a paper accepted. I have 20 to 30 papers out in peer review right now, and I expect them to be rejected. And I think that's because, that's the peer review process. And also, I aim really high with my research. So if it gets rejected, then it gets rejected. I find another outlet. We were awarded a grant, and I still can't believe it was a World Health Organization grant for a project on waste pickers in Brazil. And what we're looking at is vector-borne diseases down there and the spread of them. And I will be the qualitative consultant on the project. But still, I'm like, I don't know, until the money is here, I don't believe it. That's definitely academia, and that's just something I've developed leather thick skin because of it. The next part of my research and my interests, and the next part of work that I'm really looking forward to doing is, really, I think I've moved from working on a lot of my own research projects to helping my students work on their own research projects. And that has definitely been an interesting process because it's a tiny bit humbling because you are no longer first author. You are sometimes, last author because you want all your students, you care more about your students' success than yourself. And so you put yourself last, even though you're probably doing all the work, most of the work, because it is hard to teach people how to write and publish and present. But that is a really fun movement into my life, and it's very different. And I am looking forward to keep working with my students in the future. I would say that I'm a very interesting person in that I don't have a lot of free time because I spend every single second of my day doing something. I am up at 5 a.m. and I'm working at that time because it's my best brain. And then from there, I take care of my 5-year-old. And then from there, I ride horses, I jump horses. So I train about 5 days a week. I fly planes, so I'm flying about twice a week. I do 2 hours of Spanish per week with a tutor. I also do yoga. I've been doing yoga for about 10 years. I do tons of biking. I love hiking. I'm a very active person. I have my scuba certificate. I snorkel in the Keys. I started fencing about 6 months ago because I'm going to start training for a pentathlon, which is an interesting event that includes swimming, fencing, horse jumping, running, and shooting. And I've done archery for years, so I sort of figured that shooting and archery were similar. So my next goal is to train for a pentathlon and actually go compete in one. It's an Olympic athletic sport, so I thought it would be fun. So I'm a very busy person in like different avenues and areas of my life, and I think that is important because if we spend all our day working, then what's the point? We have to also find like that moderation and that balance between things that we want to grow and achieve in our own life and things that we want to do for other people, including our families. I found that there is a balance and growth happens within you as well. And when you feel good about your growth, you can help people achieve that growth as well.